Hi, my name is Stacy Smith. I'm a candidate for Cincinnati City Council. I'm a therapist, and much of my platform has to do with expanding mental health care access in our city. Over the next couple of weeks, I'll be sharing videos that highlight my plan and platform so that you have a clear picture of what I hope to accomplish if elected to City Council. I'll also be sharing about how the needs we face in our city tie into mental health care. In other words, how expanding access to mental health care in Cincinnati can help with some of the other issues that we commonly face. Today, we're going to start by talking about policing and first responders. I fully understand that this is a sensitive subject. I also understand that some of you may disagree with me, and that's okay. I welcome that. One of my plans is to expand our mobile mental health crisis response units. As of right now, the city of Cincinnati only has one. It's operated out of UC, and it responds in 3 of our city's districts. We need much more than that. Right now, most of our mental health crises are dealt with by Cincinnati Police Department. And I'll pause here to say that our city does more to train our officers on how to deal with mental health crises than many other cities. We do have that going for us. However, there are other cities that are doing more to take that off of their police department's plates and to put it in the hands of trained and licensed professionals with some excellent results. Take Denver, for example. They recently started their STAR program, which is a very, very small team of trained professionals who go out and handle low-level mental health crises. In their first 6 months, they handled 748 calls. 748 calls that would have either not been responded to at all or handled by their police department. Instead, 748 people were able to be assisted by this small team of mental health professionals and were able to receive the help and the care that they needed in their first 6 months. This is absolutely achievable, and I hope to make this happen in Cincinnati. Here's how. First, I would like to develop partnerships with our other hospital systems. As I mentioned before, our current mobile crisis unit is operated by UC Medical, but we have other healthcare systems in the city that could be doing the same thing. TriHealth, Mercy, Good Samaritan. All 3 of these could be amazing partners with the city to provide more mental health resources, especially for those who are in crisis-type situations. We could have teams of social workers and therapists out of each of these hospital systems who can respond to calls as needed. To fund this, I hope to start by reaching out to the Hamilton County Mental Health Board. Right now, they currently pay for the services that UC provide through their mobile crisis unit. There are also other grants and programs available for this exact kind of thing. It's just not being asked for right now in Cincinnati, and I hope to change that. Now, further down the road, as this becomes more successful, I absolutely would feel that it would be appropriate to reallocate some funds from Cincinnati Police Department for this initiative. Here's kind of an analogy to explain that. Let's say I am hired by a family to babysit their kids. And after a few weeks, it's going well, and they decide that they would like to pay me an extra $20 to also clean their house. We try that for a while. It's great. But then they decide they want more out of the house cleaning, so they hire a cleaner. So now I'm just responsible for watching the kids. The cleaner is responsible for cleaning the house. Would it make sense for that family to still pay me that extra $20 for a service that I am no longer providing? No, it does not, and it would not make financial sense for our city either. So if we have police officers who are no longer responding to mental health crises, that means we won't be spending taxpayer dollars on it either. So my hope would be to at some point take some of that money that we're not using for CPD for this exact purpose and funnel it into other mental health resources. Did you know that individuals with untreated mental health disorders are 16 times more likely to be killed by police officers? That is a horrifying and sickening statistic. And I truly believe that if we can expand the mobile crisis units we have in our city, we can cut that number down. Not only that, we can be a beacon to other cities to show them that if you put if you prioritize mental health care and mental health crisis response, it saves lives. So I really, really hope that we can make this happen in the city, and I'm going to work hard to do so. On the topic of CPD, as well as our other city first responders, I want to develop a better system so that all of our first responders have better access to mental health care as well. As of right now, to my understanding, I went through and read CPD's policy on this, and let's say an officer is involved in a situation where their life is threatened. They are highly encouraged to seek peer support because they have a peer support program. They're also encouraged to see their contracted psychologist. And from what I've researched, there is only one contracted psychologist working with CPD right now, which to me sounds like an issue. But here is something to consider. When it comes to traumatic or life and death experiences, which many of our first responders face on a regular basis, there is a very short window, clinically speaking, where the incident can be processed and addressed and have much less effect on that individual's mental health moving forward. That window, again, clinically speaking, is about 72 hours. It is not very big. So if you have, a group of individuals, so all of our first responders who are, facing these experiences on a regular basis, you have one psychologist contracted to work with CPD, and you have kind of one peer support team within the precinct or the department, and on top of that, you have the job to continue doing, you have all of the paperwork to file for those incidents. Many times these are not being processed within that 72-hour window. So then what happens? The individual is much more likely to develop some kind of adverse response to that traumatic event because that window has closed. My hope is for all of our first responders to work with our mental health providers in the city to make sure that their mental health care is much more accessible and even more prioritized than it is now. This will help prevent burnout. This will help prevent kind of what I call a mental callousness, where we kind of become hardened by our experience and have a difficult time showing empathy, care, compassion. Many of these things are very common in, fields in high demand like policing, fire departments, EMS. So by making sure that we're taking care of their mental health, we can also then help equip them to better respond to our city. So that is a very quick summary of some of what I hope to do in the city as far as, policing, first responding, and kind of blending that into the mental health resource expansion. If you have any questions, any critiques, any suggestions, please feel free to reach out to me. I would love to talk with you. Until then, consider looking at and supporting my campaign. You can follow me on Twitter at Stacy Smith CCC, Stacy with an E, or you can visit my website, stacysmithccc.wordpress.com. There you can learn more about me, more about my platform. You can read character references and donate to my campaign if you would like to. Until next time, take care.